Like, is there so for me and my patient, right? I got my meniscectomy patients, and I have my, my biceps tenodesis patients, the simple kind of recovery ones. But then I have my bigger stuff, like my ACL meniscus cartilage transplant. We're talking about like 3 hours of surgery, a lot of work, a lot of atrophy, non-weight bearing cartilage transplants, you name it.
Yes.
So are those the ones that you would focus on first if you're kind of trying to start this practice
100%,
up and trying to start the
100%.
nutrition?
Yeah. So we have kind of this, if you on the website, we have this kind of the high demand patients, and we broke it up into 2 categories. We got the high risk, which are the infections, diabetic, smokers, revisions, the elderly patient, massive rotator cuff tear, right? You got that group. Those are the kind of high risk patients. And then on the other side, you got the high demand patients. Those are essentially our athletes, our patients trying to get back faster. So I think those are the 2 patients that really are looking or would really benefit from it. But
and you can have sometimes they can cross. I mean, I've got some patients that are crazy high demand, have had 3 failed surgeries too, and that's also important. And those are maybe almost the ones that are higher.
That's a no-brainer. So, in my conversation with my patients, we all go through our discussion with our patients, and one thing that comes up regardless of who you are and what surgery you're doing is patients always ask about their recovery, right? So tell me a little about my recovery. Whether you're doing whatever you're doing, how long am I going to be in a sling or my brace? So I basically add this to my conversation. I say, look, in order to improve your recovery, we try to optimize your nutrition by using a supplement that provides you what you need for improved healing. That's it. And then really the company really takes over as far as it's like a concierge type service where they explain this to the patients. We have a whole what's called the muscle sensor calculator. So if I could do it for you right now, I would. You can go online and you could put in your body weight, your sex, your age for you, and then it would give you a meal plan. So again, it's not just about the supplement. It's not just about the physical therapy. It's also about what you're actually consuming. So we provide all these resources for patients who would otherwise have to go to some nutritionist or something.
Does that come with your, okay, let's pause there. I want to talk about your company because no one even said anything. We haven't even shown a picture of it.
It's all good.
And we're getting distracted, but I want to focus. So that topic. So tell us about this company and then tell us about what comes with it. So you got your supplementation, but also the background stuff that you were just getting into.
Sure. So, I'll tell you how this kind of started actually. So my personal background before med school, I was in skeletal metabolism. And so that was pre-med. So I was like kind of doing biopsies on rats anyway and understanding how muscle works. And that was before med, so I kind of had this in my
background. He was a natural surgeon. He was biopsying muscles before he started.
So I had this in the back of my mind, but then a few years back, I had a patient who came to see me for a revision ACL, and he did an osteotomy. He came back and he's like, "Doc, my leg is finally stable, but I lost all my muscle. What do you have for me?" And so, I live in an area where the primary care docs, they talk about anabolics, they talk about growth hormone, they talk about peptides, and they talk about, supplementation. And so when I talk about supplementation, he's like, "Well, Doc, do you know about all the amino acid stuff that we're using for NASA?" And I said, "Oh, whoa, what do you know?" And so that blew my mind. So I called him back and we brought him on. Essentially, we are really, really late to the game. The guys who've been really studying this, NASA got onto this a long time ago because they had to study what can they do in order to prevent the really rapid muscle loss that happens when you go to outer space. And so in order to be able to prevent muscle loss, you can't take a bunch of food with you, but they identified what were the key amino acids that you can consume to prevent muscle loss. This is where all the studies actually started from, okay? It came from muscle loss studies in order to prevent that degeneration that you see in outer space. And then